So these are some follow-up X-rays from yesterday's patients. Advance, please. So this was the first patient. She had a varus, which was roughly around 9 degrees and had a concomitant root repair as well. Next, that was the planning. We planned for a 10 millimeter opening to bring her MPTA to 92. Next slide. And these are the post-operative X-rays. Next. And the MPTA has been restored to 91. The limb is neutral. Next. And the slope has not been altered. Next one. The next case was the one which I did, which was slope changing, valgizing, high tibial osteotomy along with a concomitant PCL reconstruction and a posterolateral corner reconstruction. Next. This was the coronal plane deformity, which was roughly about 5 degrees in the coronal plane. Next. The correction that was planned was 6.9 millimeters of opening. Next. The monopedal stance view had a very low tibial slope of 3.6 degrees. Next. And these are the final outcome X-rays. You can see that the osteotomy which I have performed is quite distal because we had to accommodate the tunnel for the PCL. Next. And the MPTA has been restored to 90. The limb was neutral. Next. And we've increased the slope to 12 degrees, which is what we want to protect the PCL. Next. The last case was, the third case was a distalizing tibial tubercle osteotomy. Next. As you see, the preoperative planning showed a patella alta with a CD ratio which was 1.3. Next. And this was the post-operative outcome with a distalization osteotomy of the tibial tubercle. Next. And the CD ratio has been restored to 0.7, which is in the normal zone. Next. The last case was a varus deformity which required a double level osteotomy. Next. This was the deformity, a 19.5 degree varus deformity on the right side with an abnormal LDFA and an abnormal MPTA. Next. This was the correction with 11 millimeter closing in the femur and an 8.6 opening in the tibia. Next. And these are the final outcome images which show next that the MPTA has been restored to normal and the limb is now straight with a closing in the femur and an opening in the tibia. Next. So this was the final outcome from yesterday's patients. I thought all of you who were there yesterday would be interested in looking what the post-operative outcomes were. Thank you so much.